Hello, thank you everyone for joining us. My name is Shaun Brewster. I'm joined today by Tino D'Angelo and Caitlin Eden. These are both co-directors with me on the board of ANTA, and I've asked them to join me today to have a discussion about a topic that has been contentious for a number of years now, especially in the Australian landscape, but also in other countries as well, with regards to acupuncture and dry needling. Now, depending on which camp you come from, which discipline you've been trained in, you'll have very strong beliefs in one direction or another. Some will believe that acupuncture and dry needling are essentially the same thing. Some will believe that dry needling is vastly different. It holds a whole different set of underpinning principles and concepts that are different to acupuncture, and they will therefore believe that they should be separated. So today we've got Tino and Caitlin. They'll both give you a little bit of a background on a little bit of story on their background, which will give you context about why I've invited them along, as I think they're both experts in the field. And then we'll have a bit of a discussion about where maybe acupuncture and dry needling should sit in the context of one another. So, Caitlin, would you like to start?
Hi, Shaun. Yeah, sure. Hi, Tino. So as Shaun mentioned, my name's Caitlin Ledden. I am the acupuncture branch chair for ANTA, and my acupuncture education has mostly been around meridian therapy, and I'm obviously trained in Australia, but I've also trained overseas as well. So I come from a meridian therapy perspective, and an Eastern or Chinese medicine paradigm.
Perfect. Yeah. Thank you. And Tino?
Hi everyone, I'm Tino D'Angelo, and my training is actually in both. So I've got a Bachelor of Health Science in acupuncture, and I have a Bachelor of Health Science in musculoskeletal therapy. So I try my best to see both sides. So I represent the Chinese herbal medicine branch. So for that, I've got a Master's in Chinese herbal medicine. And that's about it from me in terms of where I'm from.
Perfect. Yeah. And look, this is a really interesting topic for me because not to the same degree as you, Tino, but I've also had some training in both. I've trained in myotherapy, and I've done a small amount of training in Chinese medicine. So I understand the principles and the concepts that underpin it. But getting a conversation with someone who's a passionate acupuncturist, and there's a whole other layer to that. So I think we've got a really robust conversation coming up now. So let's start with maybe, again, we'll go to Caitlin first. If you could state, first of all, your position on where you think dry needling and acupuncture sit in the healthcare landscape. Do you think dry needling is a component of acupuncture, or do you think there's also a separate way of delivering that which sits outside of the Eastern medicine philosophies?
Okay, so let me just tease that one out a little bit. So acupuncture I see as a technical modality, in as much as it is a technique. So acupuncture is the technique of inserting a filiform needle into the body to produce a positive and desired effect. Whether you use that technique within a Chinese medicine paradigm or purely within a musculoskeletal paradigm, dry needling as a technique is acupuncture.
Okay, so you're saying that based on the definition of those words, we're talking about the same thing.
Yeah.
If those words purely just describe the insertion of a needle to produce a therapeutic outcome.
Yeah,
okay,
that's right.
All right,
yeah.
Great.
And obviously that's I'm being very specific about the terms, because often when we have these conversations, those terms take on a much broader understanding, or they actually have the weight of a whole modality or a whole system of health approach with them. But I am being very technical about that and trying to be very specific, and I'm not it's not because I want to be pedantic, but it's really that if we look at it purely as a technique, then dry needling and acupuncture are the same thing. But obviously I appreciate that those terms are used as shorthands to describe a whole range of other approaches, but right. That's essentially where I come from.
Okay, understandable. And I guess there's a whole protection of title component that goes with the term acupuncture as well, so that's another thing to consider.
Yeah, from a regulatory point of view, so I probably wasn't going to talk about that, because my feeling is that actually all dry needling should be registered in the same way that acupuncturists are registered. So if that's maybe a different conversation for a different time, but in terms of protection of title, acupuncturist is obviously a protected title with AHPRA, but that's more a position of statement rather than like a positional statement rather than actually a sort of a technical understanding of what the medicine is doing.
Okay, fine.
So
Great.
I mean, I look at it from the point of view of dry needling and acupuncture are both they're essentially the same thing. They are a medicine. They are an application of a medical paradigm, but obviously the medical paradigms that they come from and that they express are quite different. But both of them should effectively, because they're essentially doing the same thing from a physiological point of view in terms of the body is being penetrated by a needle, then my feeling is that anybody who does that should be registered. Okay. So that's, I guess, the position I'd come from on that.
Okay, thank you. Tino, what's your position on this debate?
Okay, so I'm going to say, so whilst respectfully agreeing, actually totally agreeing with what Caitlin is saying about the act itself, but in terms of the tool itself is exactly the same, and it's being inserted through the skin into the body. And I do have views similar to Caitlin in the sense that perhaps it should be regulated, and it should be regulated because it carries a substantial risk to the patient, and probably even more so dry needling than acupuncture. And the reason for that is because with trigger points, so they can be although they're, shall I say, semi-predictable in terms of where we find trigger points, they're not as predictable as acupuncture points. And if you've studied acupuncture, you would know that not only the points are measured, but also we've got in terms of we're taught in terms of needling angles, needling depths. It is actually a lot safer than dry needling, because with dry needling, so firstly the trigger points are varied, so they can be a centimetre out from where we would expect it to be, and then we've got no idea of angle and depth. So what we have to rely on is then our anatomical knowledge. So for what I'm saying there, so it does carry a greater risk than acupuncture, I believe. But just to answer your question, Shaun, it's I think that they're different things apart from the actual instrument and from physically, inserting a needle into the body. I think we've got to look at what the actual aim is. And fundamentally, if we look at the differences between an acupoint and a trigger point, we can see that they're actually different things. Okay, that's also arguable in itself, because we can say that acupuncture points, the mechanism of action would be, perhaps using the sympathetic nervous system or, the nervous system as a whole. And trigger points can also be claimed to do the same thing in terms of probably results that we're not anticipating on. So, but the goal of trigger point needling or trigger point dry needling, and I'll just make the point now, so whenever I document on my patient records, I call the practice trigger point dry needling. And I do that because I want to make it clear what it is that I'm doing exactly. So I'm needling a trigger point. So going back to trigger points and acupuncture points, I think fundamentally they're a different thing. So if we look at the minimal essential features of trigger points, in order to say we're needling a trigger point, so first of all, we have to have a taut band. So a taut band is probably for me the most important aspect of a practitioner saying that they're needling a trigger point. And that's absolutely absent in acupuncture points. So if you palpate an acupuncture point, you will not feel a taut band. Okay, so which means a trigger point is only present when the muscle is in dysfunction. And so taut band is number one. Number two, exquisitely tender spot. Okay. Number three, patient's recognition of the pain. And number four, a painful limit to the range of motion. Okay, and that comes directly from there being a taut band that limits the range of motion of the muscle that's affected. So, I mean, I could go on, but to cut it short, the angle that I'm coming from is basically saying that trigger points and acupuncture points are totally different things, and therefore the aim of treatment is totally different. So therefore, that's the basis of why I'm saying that it's a different practice.
Sure. Okay, so based on that, Caitlin, I guess you've both taken slightly different approaches. Tina, you've focused on a different, physiological structure or target tissue for the needle, and Caitlin, you've taken a definition from what the definition of the word means, acupuncture or dry needling. Caitlin, did you want to add anything further to what Tino sort of said in his direction, and maybe we can go back and forth on that?
Yeah, I mean, look, I don't necessarily disagree with what Tino said, except that when he says that a trigger point, there are certain criteria for what a trigger point is, or what a trigger point, how a trigger point is identified, and I don't know how useful it is in some ways to get into a conversation about, well, this is what an acupuncture point is and this is what a trigger point is necessarily, because an acupuncture point can have a tightness or an exquisite tenderness or a pain to it, and also, if once you needle that point, it can affect the range of motion. So given that criteria of a trigger point, there could be many ways in which an acupuncture point might also be identified with very similar criteria. So then I guess the point is, maybe what are you actually trying to do with treatment? And I guess my only question on what Tino has said is, how do you perceive muscle and trigger points within muscle tissue within the framework of a human body? Do you understand what I'm saying? So it's like, we can look at muscle only, or we can look at meridians, and then of course that's a whole other discussion about, well, what's a meridian and how do you find it and how do you palpate it? We say in acupuncture, and I don't know whether it's said in dry needling, but certainly within acupuncture there is an understanding that the paradigm is an external method of treating the internal body, right? So you can at least suggest it or infer that you're treating the organs as well as the meridian or the muscle. So from a dry needling perspective, where do you put muscles and muscle tissue and the musculoskeletal function as the primary or the top of the hierarchy? I guess that's what I'm asking.
100%. Yeah, and really, really good question, Caitlin. I think, and that's the reasoning, for I was saying the patient notes before, for me writing on a trigger point dry needling. I think that's, it's actually a really crucial point that you've raised, and really this shows a lack of education, probably on both sides here, so both camps, and so I really want to strongly say here that dry needling is limited to that. It's limited to musculoskeletal treatment. Whereas, so the depth of acupuncture goes well beyond that. I mean, that. And so therefore, we can view it in another light. We can say, well, trigger point needling could be part of acupuncture treatment, but it's only a very small component. And I do agree with that. And this is where, I think, and I can talk about this later, I think education is key here. It's not about both sides, warring with each other, because that's not what it's about. It's about, okay, like what Shaun said. So how do we, how do we resolve this? How do we step forward from this? And and I think education is key, but I'll talk about that later. But yeah, really good question. But yeah, so that, I think that's the limit of dry needling. It's the musculoskeletal system, and further, like even more specific, it's to deactivate a trigger point. Simple.
Okay.
Easy.
Okay. So I guess what I would say to that is that in a way, I don't have any argument, or I don't have any issue with dry needling being sort of saying this is what we're doing, and it's not that it's monopolizing the treatment of muscles, but it's really saying we're putting it at the top of the hierarchy in terms of our approach to the human body. We're putting muscles first, and really all we're looking at is muscles. So this can totally be encapsulated or contained within a broader acupuncture practice. And that's probably where I'm coming from, is that in a way it's like acupuncture, as we know, has in fact actually a lot of modalities. It's not just acupuncture and the technique of acupuncture. It also includes moxa and gua sha and cupping. Now, gua sha particularly and cupping are very good for musculoskeletal or fascial problems, fascial adhesions, fascial issues. So if you're treating muscle, at some point you're also treating fascia. So then gua sha becomes another part of your toolbox, really, for how you might want to best treat the body in that sense. But I guess as an acupuncturist who's informed from an Eastern tradition and from particularly a meridian therapy tradition, my question then around dry needling and around dry needling practice is there a big enough, or is there capacity within dry needling practice to recognize the body as a biosocial, psycho-emotional, ecological creature, which is what acupuncture does, right? So what I'm getting at is, does it seek, or does it have any kind of claim to holism, or to a sense of sort of holistic health? Or are you really saying dry needling is just very perfunctory, it's very sort of, it's just this thing, and that thing's fine, but it's just this thing? Do you know what I'm saying? Do you know what I'm asking?
Yeah. And I think I really agree with you there. And I would say that various modalities, various musculoskeletal modalities will encompass holism. But holism, I don't think, in my understanding, I don't think as comprehensive as Chinese medicine does. So Chinese medicine encompasses that whole biosocial model. I think there was another part to it that I missed that you said.
Yeah, sorry. It was a bit of a mouthful, and I sort of mangled it myself. It's a model that in a way actually Chinese medicine and Eastern medicine paradigms really excel in, and that is the idea that you cannot split mind from body, you cannot split the individual from the environment, right? That this claim to holism that so much of us seek is really actually contained within that paradigm, because of the way in which the diagnostic systems basically speak to the relational nature of the human being, so that what is relational is the muscle, the skin, the fascia, the meridians, the organs, and all of those then have a response within the environment. So I know I'm getting a little bit off track there, but that biosocial, psycho-emotional, spiritual, ecological, creature model as a human being is then, it gives you a whole range of treatment opportunities. And so I guess that's where I'm going to, because the other thing that strikes me as really interesting about this conversation is the way in which we look at the body. So the paradigm in a way creates the looking, right? From a Chinese medicine perspective, traditionally, classically, muscles were not a big part of the literature. They're just not really discussed. Now, it's not because the Chinese didn't see them, it's because they didn't see them, they didn't put them in the hierarchy that Western medicine, which comes from that Greek tradition, does. You look at the Greek traditions, and it's, muscle is everything, particularly the male muscle body. The male muscle body is like, wow. We don't have that representation in Chinese medicine. So this is just a kind of a very sort of shorthand way of expressing how it is that we see. So it may be a Western Greek, Greek medicine, from the ancient Greek traditions. This is how we see the body, and muscle is very much at the top, or at the top of the hierarchy for what we treat and how we see and how we understand the body. It's whereas Chinese medicine doesn't look at it like that.
Okay, and you raised a really good point.
I think. Oh, sorry, Shaun.
That's okay. Go ahead, Tina.
Oh no, and I think again, I 100% agree with you, but I think there you've actually stated there the difference, because from a musculoskeletal perspective, yes, the muscular system, the fascial system, and obviously the skeletal system, so they're at the hierarchy, they're at the pinnacle. However, there are certain musculoskeletal modalities that will encompass a more holistic view. Now, that's not to say that view, or more so that, so the view is possibly as holistic as Chinese medicine, or almost, but the capabilities are perhaps not. So our practice of Chinese medicine, practice of acupuncture, so we have the ability to fully encompass all of those holistic models that you were speaking about, but manual therapy is limited in what it can actually achieve. And I think that's where the focus should be, in terms of what dry needling is hoping to achieve. And like I stated before, it's simply deactivating a trigger point. And then in doing that, we'll have a whole host of reactions that will permit, some of which might be, mental, emotional. Somebody might be in so much pain that it affects their psyche, and it might release that. But that's not the aim. That's quite simply, and that's where the practice should be limited to. The claim shouldn't be anything else other than musculoskeletal, and more specifically trigger point related.
I think the two of you may have actually found a solution here, or the center of it all, which is, and I guess one of the major arguments that underpins this discussion is that, particularly a lot of people in the Chinese medicine camp and the acupuncture camp will say that people performing dry needling without classical training in acupuncture are performing a watered down version of acupuncture. I've heard that stated before. And now if we take the concept you mentioned before, Caitlin, that, acupuncture is a more holistic approach to the human being. It's a whole system of medicine. And then we look at dry needling. Dry needling itself is not a system of medicine. It's a tool in the toolkit of a practitioner who applies a Western model of medicine. And so is dry needling a holistic approach? No, it's one technique. But could someone using dry needling incorporate a holistic approach? Could a physiotherapist, a myotherapist, or a medial massage therapist, an osteopath, anyone use a holistic approach that could be as equal to, or in some way equal to, what acupuncture does? I think yes. But dry needling shouldn't be seen in the same light as acupuncture, because it's a component, it's a skill set within a paradigm approach. Do you think maybe that's the answer?
Look, in a way, I don't know that we're speaking cross purposes on this. I mean, in a sense, I come back to my original definition of what acupuncture is. Essentially, acupuncture, for want of a better word, is effectively, if we're just looking at the technique, we're not looking at the paradigm that holds it. We're not looking at any of those bigger issues. Then dry needling is acupuncture. Acupuncture is dry needling. It's kind of one and the same thing. Of course, the terms that we use, so that again, acupuncture is used as a shorthand to differentiate the technique itself from the broader system of paradigm and diagnosis. And so when you say acupuncture, what you're actually meaning generally is I use I use inserted pins from within a Chinese medicine paradigm, or yeah, usually that's what you're saying. And the diagnosis that I'm coming to comes to me from a Chinese medicine perspective. But in a sense, regardless of what perspective we come from, even if you actually don't necessarily want to treat in a holistic way per se, you are still actually approaching and treating the human body. And when you do that, because it's a human body, in fact, because it's a body, I mean, you can also do it with animals, but let's just keep to the humans. When you treat the human body, you are treating somebody who is not separate from their environment, who is not separate from their emotional history, from their familial history, from any of that stuff. Now, that may not be something that you want to get into or that you are necessarily interested in. It may not be relevant, but you can't sort of say, oh, well, we're just doing this and this is all we do because that person is actually bigger than that. Does that make sense? I mean, I don't know whether I'm quite getting the point across there.
Yeah. It does. To me, it does, Caitlin. I suppose my comment on that would be as an acupuncturist or as a Chinese medicine practitioner, what I aim to do in that respect, in a holistic respect, is very measured, and so I'm looking to to work with those outcomes, those holistic outcomes. But so if I put my other hat on from a musculoskeletal therapist's point of view, do I understand that there are these other these other elements to the human body? Yes, I do. Am I specifically trying to manipulate those other elements? Probably not specifically. I understand that it might have a bearing, well, it will have a bearing on it, but that bearing purely from a musculoskeletal approach is not really measurable. I mean, like a physiotherapist who performs trigger point dry needling, they are doing so with the sole aim of, like I said before, of releasing the trigger point, and the aim being to elongate muscle tissue, possibly release fascia, and that's where it should end. I mean, anything other than that, then if they practice holistic medicine, they need to practice it within their paradigm, which is limited to their paradigm, not this quasi acupuncture that we're that's commonly seen as.
Yeah.
And this is,
I get that a lot. I get that a lot from clients, say, have you had acupuncture before? I said, yeah, I had it with a physio. I was like, oh, right, okay.
Yeah, I get it too.
Sorry, physios.
No, and I think, I think it's everybody's fault. It's not just the physios. It's not just, the musculoskeletal therapists or myotherapists. It's everybody's fault. And I think it comes down to education, and I might be jumping forward here, but I think really the answer is understanding our limitations. And for the Chinese medicine side, we're as guilty. I think our guilt lies in not accepting trigger point needling as a tool. I think we can learn from that. And certainly the way I practice, I use dry needling because I've got a foot in both camps, but I use it as a tool, but I incorporate it with the holistic approach that I can use as a Chinese medicine practitioner. And for Chinese medicine, I really see that as being the future. Just drop your guard down a little bit, maybe ask some questions. Is there any validity in the technique itself? Can I use it within my Chinese medicine paradigm? And if the answer is no, then that's fine. But for me, I think it's very valuable to the way I treat. So the other side of the fence, basically, the other camp, it's to do with education and limitations, understanding that, hey, just because I can stick needles in, it doesn't mean that I can now do acupuncture, or I can affect, I can look up, what's the action of gallbladder 20, oh yeah, it helps headaches. So because I'm doing, a trigger point on the trapezius muscle, it doesn't mean that I can put gallbladder 20 in and affect, help that person's headache, because they don't know enough about that paradigm. Just at a very simple level, they don't know how to balance that out with any distal points, and it could actually make the headache worse. So we understand that from a Chinese medicine perspective. So their lesson on the other side is actually to put a box around the tool. And so it's all about limitation and not encroach on our space. My argument often, I argue about, the chiropractors, the manipulative physios and the osteopaths do that quite well. Nobody else can manipulate. Why is dry needling, or why is acupuncture not any different? So there should be limitations in the practice, and that comes back to education. So it comes back to the institution that teaches dry needling, and how they've taught dry needling. If they teach it in a very grey manner, then that's not acceptable. It needs to be black and white. It needs to be, this is dry needling, this is acupuncture. There's the line.
Yeah, I think you're right, Tino.
So for me, it's very simple.
There's definitely been a muddying of waters, and I think that might be part of the reason we're even having this discussion right now, is because historically before there was enough people to train therapists in Western dry needling, from myofascial perspective, we had acupuncturists teaching basically tender point needling. That would be a watered down version of acupuncture. And it might be why we're having this discussion, is because people are taking one paradigm, taking a small little snippet of that and saying, well, here's dry needling now, but teaching in the context of Eastern philosophical models, which is, if that doesn't muddy the water, then nothing will. So, Tino, you're saying that the way to move forward is to really separate those two things, see dry needling for what it is, for what it's capable of and what it's not capable of, recognize that it's just a tool in a toolkit, and that acupuncture is a whole philosophical approach, and the use of needles is part of that philosophy. Would that be right in summarising your position?
Yeah, for me, yes, definitely. And that's certainly so. In our earlier days, Shaun, so we both taught at the Australian College, now Endeavour. My very first, so I taught the dry needling there. My very first lecture was on the differences, and certainly all of my students knew not to cross that line. But unfortunately, I don't think that's how everyone teaches, and I think that's really, really important.
Yeah, and to show a mutual respect as well, right? Respect for acupuncture for what it is. Yeah. It's a powerful tool. So it's not. Sorry, I shouldn't use the word tool. It's a powerful paradigm or a powerful approach. That's what, again, the wrong language can get us into trouble, right? That's awesome. So, Caitlin, would you like to add any more to the way forward? How do we solve this challenge or this conversation going forward?
Yeah, look, I think that there are kind of, so much of the way human beings engage with technology, right? So let's just call dry needling acupuncture a technology, and by acupuncture I'm coming back to that very specific distinction that I made earlier on, that they are effectively the technique. The technique is the technology. How you apply the technology, so the paradigm within which you do that, is ultimately up to you and up to your particular preferences as a practitioner. So what I would say in some ways is that the technology, and this is the difficulty that we're in terms of the regulatory environment. Okay, so the regulatory environment has regulated Chinese medicine. Chinese medicine is an approach. It's an approach that incorporates a whole range of technologies. If we talk about acupuncture as a technology, gua sha as a technology, moxa as a technology, cupping, herbal medicine, right? All of these are technologies. How we incorporate them, how we apply them to the human body comes from the paradigm. So in a sense, it's like, well, do we put the technology at the top of the hierarchy and then the paradigms underneath? So we say, well, technology is here. This is the practice. The paradigms are Eastern Chinese medicine, Western medicine. You can do both if you're trained to do that. But that's how I would see the hierarchy in a way. But that's not how the regulatory environment has seen it. And so therefore we have a structural impediment effectively. And that's in a way also why this conversation is one that we need to sort of keep having, or that people do keep having, because that kind of creates or sets in the landscape a kind of institutional, it institutionalizes Chinese medicine, right? Chinese medicine is part of, the APRA registered health professions. They're therefore in that sort of landscape. They're a kind of entity now. And so there's, of course, all of this protection and requirement around, oh, well, this is our territory, and, you can't have our territory because this is somehow a threat to our practice. It's the only threat that I see in the practice is the protection of the public, which is the reason why we were registered in the first instance, because it was seen that people who were sticking needles in other people, apart from being voodoo witches and a bit weird, really needed to be, regulated. And I guess that my feeling is that anybody who uses that technology needs to be regulated in the same way, but I just don't see from a regulatory point of view how we do that.
Yeah. So you think there needs to be more oversight over the quality of education and the practices in clinic? Yeah.
Absolutely.
Okay.
Yeah, for sure.
Great. Guys, this has been a great discussion. I knew it would be really well balanced and respectful, and you've both done a great job. So thank you so much for your time. I think that anyone listening to this, whether they're from the Eastern philosophical approach or a Western philosophical approach, I think either camp is going to get a lot from that. And I really appreciate your contribution.
Thanks, Shaun.
Great.
Thanks, Tina.
Shaun.
Yeah, thanks a lot.
Caitlin.
We'll see you again.
Yes.
Bye.
Bye.